mega stories of the past year, Cigna and Express Scripts announced a $67 billion merger. Well, guess what? We get to listen in on this next conversation. They are raising the curtains and get to hear firsthand what this mega merger means and what the future holds. I'd like to introduce you to your moderator, Anjali Kamani. I said it right before, Kamani, from Yahoo Finance. Let's welcome them to the stage.
Thank you. Thank you, everyone. Welcome. And please give a round of applause to the Chief Innovation Officer and Senior Vice President of
Clinical Research and New Solutions.
Yeah, it's too long. I just made him do it for himself. Glenn Stetton, everyone.
Thank you.
So, as was just mentioned, obviously it's been a very incredible year for Cigna and Express Scripts, clearly with the merger and this announcement of the digital formulary. So let's start off with the merger. Why don't you tell us a little bit about what's life been like behind the curtain?
Sure. So we're about a year in since Cigna purchased Express Scripts. And together we now serve over 160 million people worldwide, over 140 million people in the United States. And from a standpoint of focus, we're really focused on how do we make healthcare simpler, more affordable, and more predictable. And by that I mean the quality of the outcomes, the cost of care, and by combining the health services business within Express Scripts, which is focused on pharmacy and medical, and you heard from the prior panel about complexity, and you heard about really the cost. We are able to help people work through, and when I say people, I mean both the consumer and I mean our clients who are large employers, large health plans. We service more than 300 different health plans in the United States to provide a better benefit experience and improve people's health more affordably.
I love the fact that you ended with affordably. That seems to be one of the top issues on people's minds these days. And obviously, the companies need no introduction. They have been well known for quite some time. So dealing with that very large volume and dealing with all of the lives that you have, at your disposal, basically, to play with all of the digital health tools that you get to introduce and to really innovate with a lot of research and a lot of data, right? What is that like? Tell me, a little bit about how this plays into, especially with the digital formulary. How does that come together?
Sure. So, as you mentioned, we serve a lot of people, and people from all walks of life with all different types of benefits. We serve young people, older people, and by virtue of having visibility to their data and their health encounters, we can detect when they have issues where we can better support them. So with regard to the digital health formulary, we recognize that we're not going to be able to invent every solution for every patient who has a health need or has a health issue. So by partnering with large companies, small companies who are innovating and creating, whether it's digital devices, whether it's applications, whether it's telehealth services, we can connect the people who need those services with the people who have created those services in ways that if you were just bringing to market a digital solution, you wouldn't necessarily have the access. And we can do it in a way that helps give our clients who pay the bills and the patients who use the services the assurance that the solutions that we've chosen, right, it's a formulary. We've vetted them clinically, we've vetted them for safety, for the likelihood of effectiveness, for the user experience, and so we're giving them some assurance that these are either going to work or likely to work or have a chance at working, and I'm using the words very carefully because there's more than 300,000 digital solutions out there. Most of them are untested, most of them are unvetted, and many of them will not work, and even those that work will work for some people some of the time, right? So this whole idea of being able to figure out which ones work, which is what we're doing with our clients, and then match them to the people who are most likely to benefit is really what resonates and is making sense.
That's a huge task, especially because you're leading the way in this. Speaking of, though, if you're looking at how to set the tone for this, I mean, when you talk about a formulary, just the term, right? Over the years, as more and more consumers because now that's what they are, rather than patients, have been learning a lot more about the healthcare system and PBMs and their role in getting drugs, in getting medical devices, has been highly scrutinized and been in some situations, it has been accused, if you will, of high drug costs. So tell me about how this plays out. If you have that as the backdrop and that's what people associate with, how do you plan to change that for the digital formulary?
Yeah, so whether it's a digital formulary or a drug formulary, and the term formulary really started in inpatient environments, it really is around a clinical vetting process for helping understand what's safe and effective. With drugs, you have the benefit of the FDA, which is basically requiring 2 randomized trials, right, that demonstrate evidence of benefit before a drug can make its claims of effectiveness and safety. For digital solutions, most are not going through any type of an FDA process, so it's created even more of a reason for this type of evaluation that we're working on. And as we roll out the solutions, and what we announced this past month was 15 solutions from a number of different vendors. But part of what we're going to have the opportunity to do is study them in the wild and make some determinations about whether they're working and whether they're worthy of continuing to be available for coverage. And that's actually a key point. This is about whether an employer, whether a health plan should pay for the solution or whether a consumer should pay for it themselves out of pocket. In terms of the benefits, what's covered, what's not covered, we don't make those determinations as Express Scripts, as an example. Our client, the health plan, or our client, the employer, is making that decision.
And to date, a lot of these digital health companies and tools have been actually pitching themselves to the employers first, right?
They have, and for our employers, many of them, right, to take a digital solution that the company itself may not be all that mature through its procurement process, through its technology evaluation and security processes and security. We're doing that work on behalf of the employers, and we're not saying you should cover every solution that we have listed on the formulary, but they can at least have the peace of mind to know that if we have vetted it and have put it on the formulary, then it's gone through that review, and we wind up accepting some liability as part of that as well.
It's fair enough. And this also plays into a lot. It seems like the company, especially now that it's merged, you're working a lot on the back end, right? You're trying to fix a lot of the inefficiencies in the health system and working on trying to bring solutions that help us, the consumer, figure out a little bit more about our health, whether it's in terms of pricing or what we actually need. There's also Health Connect 360 that ESI launched. Yeah,
so Health Connect 360 is a program that we launched that links our specialized pharmacists. So we have pharmacists that specialize by disease, similar to how physicians specialize by disease. And it connects the pharmacists with the patients, or patients with the pharmacists in the conditions where they need them. And it has allowed us to make clinical guarantees, outcomes guarantees to our clients. So for example, as part of Health Connect 360, we have about 36 now different metrics, from people with diabetes improving their control of their blood sugar, or people with hypertension including improving the control of their blood pressure. The capability allows us to produce those metrics for our client from their population's data in real time. And it also allows us to identify the patients who are not in control with regard to their health needs and connect them with not just the pharmacist, but this is where the digital health formulary also feeds in. We can have the pharmacist making a suggestion to the patient or offering to the patient different digital solutions that might help them in managing their health condition and bring it under control.
That's interesting. So you almost have to use a traditional route to get people to use the technology.
Yes. What is so attractive about digital solutions, particularly those that have a smartphone component, that's where people are living, right? They're spending so much time on their phone, you have to be there to get their attention and be able to connect with them. On the other hand, it's not the only part of the solution. People don't necessarily think that they're going to follow the advice of something that comes out of their phone or necessarily trust what's there. So combining a clinician who is there and available and sometimes making outreach to help the person understand things, and also giving some credibility to the digital solution as well.
Fair enough. Talk about attached to our phones and feeling withdrawal from not having my phone in my hand right now. So what are some of the other technologies that Express Scripts and Cigna are working on right now?
Sure. So telehealth, which I do consider part of the digital health solutions, is particularly important. And lots of folks who are working in telehealth have been thinking about acute visits and behavioral health, and of course those are solutions that we offer. But what we're very proud of, and actually we're sort of talking about it for the first time from this stage, is a telehealth capability that gets at the issue of wellness and primary care. And specifically, we have lots of people, particularly younger people, who, more than half of people under 30, or close to half of people under 30, don't have a primary care physician. It's probably about 35, 40% for those under 40.
Guilty.
And if you're young and you're healthy, you probably don't need one, right? But on the other hand, if and when you get sick, and anybody can get sick at any time, you're gonna need one. And if you're not getting the recommended screening, think about US Public Health Service Task Force recommendations for screening for high blood pressure and high cholesterol and diabetes, you're missing out. So we're offering a way for consumers who either don't have a primary care physician because they haven't figured out how to get one, or they just don't want one, to still have the ability to have a telehealth visit, to get their laboratory test, their screening test done, and if they wind up needing a primary care physician, also facilitate the ability to connect them with physicians that could be helpful to them.
Well, this is a lot going on. You have a lot of tech investments. How does that translate for the public to more affordable healthcare? How does the investment in this technology translate into that?
Yeah, so I would describe us all at an early stage in terms of proving the value here. But if you think about the way that our current healthcare is organized, right, it's very expensive. The physician is very expensive, the hospital is very expensive, the procedures are very expensive, the drugs can be very expensive. And if we don't change the processes of care so that we can use the knowledge base that's out there to be able to take care of lots more people at scale, we have so many people who are not getting the care that they need, that don't have the access. We have to use technology to dramatically change things, but we also have to prove that it's better than what we have now, or at least getting service to people that is valuable, people who don't have access or are using services that are good for them at the moment.
It seems like one of the biggest hurdles still, even with all this investment and with all the outreach that you're trying to do, one of the biggest hurdles is the adoption of a lot of this technology. I've received calls to try and get me to use some sort of tool or technology in the past, and they haven't paid attention. So how do you overcome that?
So one of the advantages that we have, particularly in our pharmacy benefits business, is that in pharmacy, when you're processing pharmacy claims, you're paying the bill on behalf of the consumer. We do that in real time because you do not leave the store with the goods unless somebody has assured the pharmacy that they're going to get paid for it. So we've set up our claims processing system as a sensor. And we know when people are newly diagnosed. We know when they're unstable because they have changes in therapy. So we've figured out a way using our claim system and our pharmacy systems as sensors to be able to engage with people at a time when they're receptive for information. Right? So if you were just diagnosed with diabetes and you just filled your first prescription at the pharmacy for diabetes, and we're offering you help to better understand your diabetes and get your blood sugar under control and prevent heart attack and stroke, you're much more likely to engage than if we just called you at random or contacted you at random. So by connecting with an event that creates what we would talk about as a teachable moment, we're more likely to make recommendations and suggestions or help you think through what's best for you to do next to take care of yourself.
This is the same strategy that was employed with MedAvail, right? With the kiosks and trying to get customers when they're already paying attention to their health.
So MedAvail, if you're not familiar, is a pharmacy kiosk technology. Think about it as it's a digital technology that allows for dispensing in the physician's office, or in a freestanding situation, although I'll come back to it because I think the physician offices and practices make a lot of good sense, but allows a pharmacist centrally to operate multiple pharmacy locations so that you can save on the pharmacist's labor and be very efficient. But also, if you understand, first fill non-adherence is an issue in pharmacy. The doctor makes a recommendation for a prescription, and sometimes people don't bring it to the pharmacy to get their prescription filled. So having the kiosk in the pharmacy right in the doctor's waiting area, you wind up having a physician who makes a recommendation. And if you think about it, if the physician has allowed the pharmacy into their waiting area, there's an implicit endorsement. And you also have the pharmacist who can video in and have a conversation with that patient about their medication. And if there's an issue, we talked about this previously, sometimes people think that their doctor picked the one best medicine for them, and there isn't anything else that might be just as good but less expensive, or maybe it's safer. So it gives an opportunity to take care of that first pharmacy transaction before you leave the doctor's office. And again, if you think about part of our mission, making healthcare experiences simpler, what value does it add to the consumer to have to leave the doctor's office with a piece of paper to go get a prescription, as opposed to they could go home with the medication that they need?
So you're pulling in that compliance
That's
there
right.
from there. And there's also a lot of interest in artificial intelligence. So we can talk a little bit about that as well, and then just sort of tying it into, there's so much of trial and error that goes on in all of this. How does the merger help or hurt? How does that help?
Well, it helps with regard to some aspects of completion of data sets, right? So if you think about medication and medical diagnoses and electronic medical records information, being able to have that connectivity and that reach, and penetration into the individual physician's practice, because few health plans on their own have the ability to have a large enough share of a physician's practice to know if that practice is following best practices or not. And I'll give you an example of different approaches that we took in our pharmacy business versus the medical business related to opioid abuse. So one of the things that we were interested in was, could we apply artificial intelligence to look at the vast amount of data? Could we identify people who are likely to have an issue with addiction or diversion, right? Fraudulently obtaining their medication, or a medication for resale on a first or a second fill of an opioid. And so we built a model, and when you have a machine that can look at more data than you're necessarily a person's able to think about, you can wind up finding things that you wouldn't have expected. You might have expected, but you wouldn't have thought to look at. So, for example, if you're filling a prescription for an opioid and someone else in your household is also on OxyContin, that's a bad sign. Or if a new doctor has joined a practice and they written a prescription for an opioid, but that practice has a bad history and now they're part of that practice, that's a bad sign. So we took it, we were looking at how do we prevent opioid addiction by identifying issues earlier. On the medical plan, they looked at how do we identify people who need to have, are at risk for an overdose, and how can we prevent overdoses, right? So now we have the ability of looking at those things in a combined way take a more holistic approach to a real terrible problem in the United States.
And you have all this data flagged that you can...
That's right.
Fair enough, okay. Well, thank you so much, Glenn, for joining me. It appears we've run out of time, so we will end there.
Sorry.
Oh, good, thank you.
Apologies. Thank you to Greg and Anjali. That was excellent. Thank you so much.